Assalamu alaikum, everyone. Welcome to the second installment of Zoom In on the Halal Metropolis. My name is Jenna Shami with the Halal Metropolis team. For those of you who are new to the series, Zoom In on the Halal Metropolis is a video series where we take a closer look at how Muslim communities of Southeast Michigan are coping with the COVID-19 pandemic. For returning viewers, thank you for joining us yet again. Today we'll be speaking to Mona Makki about her role as Director of the Community Health and Research Center at Access and her role on the Michigan Coronavirus Task Force on Racial Disparities. Mona, thank you so much for joining us. How are you doing?
I'm doing well. Thank you for having me.
Of course, I'm so excited to interview you. So, with the Coronavirus Task Force, I'm just curious, can you give us a little insight on like what your role in the task force and like a day-to-day operations and how it works?
Yes. So the Michigan Coronavirus Task Force on Racial Disparities began April of 2020, and the members of the group really serve as an advisory in an advisory capacity role. And obviously, when the pandemic hit, there was just so much unknown, and we saw how it impacted the Michigan area and our communities, and how people were being impacted. And so it really looked at the causes, looking at the causes of racial disparity, looking at making sure that we were having access to testing, looking at making sure people had access to primary and mental health services. And really looking at the data, making sure that the data was being reported and was being transparent when, looking at racial and ethnic groups, and also, to remove the barriers that existed. So, it was a time of panic. It was a time where people needed to be tested. People needed information. There was media campaigns out there to provide education for people to stay home, stay safe, precautions that people needed to take. And so that group met, and it also looked at, I want to talk about, structural racism.
Sure.
It also, looked at to mitigate environmental factors contributing to the high exposure during the pandemic, resulting in high mortality. So there was a number of things going on, and this group met weekly. I mean, it was such an active working group. It had representation of all people, all communities, which was amazing. And obviously, my role was, to represent the Arab American community, making sure that, we are not being forgotten, and making sure that we are addressing the issues that are impacting our community. And so and then the group, there was two subgroups that also met weekly, the primary care group, and then there was the strategic testing infrastructure work group. And that's where I was, mainly my main role in there, because when the pandemic hit in March, I think the first case was March 13 of 2020 here in Michigan.
Yeah, I remember that.
Access, immediately partnered with Wayne Health and Wayne State to figure out, what are we going to do? How can we help the overwhelming healthcare systems? How can we make sure that people had access to testing? And right away, we ramped up our efforts and started a drive-through testing site. And then that later became mobile testing. We went throughout the state of Michigan, but as you remember, we had to follow the governor's orders and the restrictions that were put in place. We started off with healthcare workers and first responders, and then started testing vulnerable communities. And so a lot of that entailed building partnerships, building trust in communities. And a lot of our work was, because early on, nobody really knew who was being impacted. It was until a couple months down the road that we started looking at hotspot mapping, looking at, the hardest hit communities, making sure that we were going into those communities, making sure that people had the opportunity to get tested. We had walk-up sites for people who, weren't able to drive through or had mobility issues or whatever issues that they were facing. And then we looked at it as an opportunity to look at this issue beyond just COVID-19 testing. We started providing high blood pressure checks. We started doing HIV testing, food distribution, navigators on site to enroll people with who needed health insurance. So there was a number of things that we learned during the pandemic, and the opportunity to further connect with community members. But if you recall, trust was a big issue.
Oh
I
yeah.
mean, people were struggling, do I get this test? What information do I give? Do I need to have insurance? So our testing effort removed all of those barriers to make it easy for people to get the testing that they needed.
That's
Um,
amazing.
so yeah, we tested during that partnership over 18,000 individuals, and we went to over 100 sites throughout the state of Michigan.
That's awesome. And it's like nice that you like more than just COVID testing, that there's like kind of like a one-stop shop for like more screenings and more tests, because like sometimes like as I've learned in like my classes in public health, like it's hard to like reach people and like populations. So like to all do that all at once is like awesome. So thank you for all that. And that was very insightful. So speaking of hot tubs, how have I was reading an article that like, and I've noticed that like hot tubs are also like sometimes like not counted. We're not counted in the census, and we're not like looked at in research. We're considered white, and so because of that, like we've been how have COVID infections and treatment have been documented in the hot tub community, because like we're like it hasn't been shown. So how have you seen the documentation with COVID and the treatments?
So that's obviously been a big challenge. I was
Mhm.
on the task force yesterday on the call, and I'm saying, and I was, very frustrated because we don't have data, or whatever data
Mhm.
is available is so limited. And, we have to be classified. We need to be able to identify ourselves if we're going to study, diseases or other issues that are affecting our community. And
Right.
without that data, it's very, very extremely difficult. And I want
Yeah.
to say that Access, for the last 25 years, has partnered with local universities. We have a health summit that we put on every 2 years, and really to focus on the health needs of Arab Americans, because
Right.
again, we need the data to show, how our community or other communities have been impacted. And I want to tell you, it's heartbreaking, because right now, if you ask me, Mona, can you tell us how many people, were infected by COVID-19 within the Arab American community? I could tell you that we were impacted, but I can't give you a number. If you ask me,
Exactly.
how many deaths did we have related to COVID? I can't give you that number, but I know that it affected our community as it affected everybody. This was a global pandemic, right?
Exactly.
And so we are still struggling in this area, and this pandemic, these issues, they weren't new. The things that we're seeing from the pandemic, with health disparities, is nothing new, but it
Right.
just kind of illustrated now the importance of why being able to self-identify becomes so critical when you're putting programs together, when you're putting services together, when you're providing education to other individuals. So that's been an issue. And I want to say that we've seen an increased, there's an increased risk of serious illness due to high rates of underlying health conditions such as hypertension, diabetes, asthma, heart disease, obesity. And we know that because we've done a lot of studies, and we know that
Yeah.
there's, high incident rates. But when you look at the national figures, it's very, very hard to make the case. So we still have a long way to go in this area. And I know this has been a topic that our agency has, been advocating for with the census for decades now.
Mhm.
And some of the disparities that we saw in the communities is, a lot of Arab Americans still live in the multi-generational housing, right?
Yeah.
And so when COVID hit, and we're telling people to social distance and self-isolate and quarantine and all of these things, that became a big challenge for
Mhm.
those individuals. We also know that we have a number of uninsured and underinsured folks in our community, who also there's just a lack of resources for them. And we also know that, we have members in our community who work in restaurants, or restaurant owners, work in retail, hospitality jobs. They were impacted. A lot of them lost their jobs, lost their source of income. So, we were being impacted by this pandemic like every other community, but
Yeah.
it was hard for us to make the case when we're identified under the white
Yeah,
category.
exactly.
And that continues to be a challenge.
Especially because like those barriers are like different. Like the Arabs face are different compared to like white communities or the black communities. Like every group has like their different types of barriers, and like I started to notice, like especially in the Arab community, that wasn't like talked about, and like it wasn't being addressed. And so I feel like that's why we were like so impacted heavily with COVID. So speaking of the effects of COVID, how do you think this pandemic will inform research and practice, and like address the medical needs of the Arab and or Muslim communities?
I think we learned a lot, right, from this pandemic. And the COVID-19 pandemic has, again, further illustrated the disparities in health in communities of color, and emphasized the importance of this aggregated data that can help us study the unique needs of each community, right? Because this is not, again, we are a unique community, but the importance of studying community specifics, as you just mentioned, every community has its own needs.
Yeah,
We learned that a lot of our communities are similar, but we're also different in many ways.
exactly.
So we hope that this will mean more community-specific research among Arab Americans that can help inform programming that is culturally tailored. That's the key, is
Mm-hmm.
that we
I
have to
agree.
be able to respond to community needs in a culturally specific manner to ensure that they're getting the help and the services that they need and that they deserve.
Yeah, I agree 100% wholeheartedly. Like, honestly, I think the work that you're doing is amazing. So, thank you so much for speaking with us today. Honestly, your insight on COVID and the whole task force and how it's affected like the Hadab community is very important. So, thank you for advocating and doing important work. If you're a listener and you have a story you would like to share with us or to be featured on the Zoom In series, please fill out the form linked below. Wishing everybody safety and health. Until next time, Assalamu alaikum.